Hey everyone, this is Dr. Bhavesh Patel, and we're here for another webinar. And today we're going to be continuing a discussion around sugars and why blood sugar management is so important. When we think about blood sugars, there are a number of different things to consider. One is that the higher the blood sugars are, the higher the risk of diabetes. 1 in 3 people have a pre-diabetic type of condition. 1 in 10 people have diabetes. And when people have this long-term issue with diabetes, and it can take 10, 15, 20 years to develop, it sort of creeps up on you. It causes a number of major health issues. People lose their eyesight, they lose sensation in their hands and their feet, they have more heart disease, more dementia, the kidneys can fail. Pretty much every organ can get damaged by too much sugar. And that's why, from a long term health perspective, and knowing that 10% of people are going to have a problem with diabetes is a very important topic. And 1 in 3 people, a third of people, are going to have an issue with pre-diabetes, which is going to give you some of those problems. The other part of it, though, is just from a weight management. The more sugar you have in your bloodstream, the more weight people will typically have in terms of body fat percentage. They'll have decreased muscle mass. Uh, and then the last piece is just longevity. The cells in your body uh, react poorly to too much sugar. Sugar sticks to the cells. When it sticks to the cells, it gums up how well those cells operate. So it's sort of like if you had, um, just bad parts in an engine. Maybe the engine's still running, but it's not doing that great of a job. Maybe there's a lot of noisiness or whatever. But from a longevity standpoint, uh, having that sugar makes a big difference. Finally, we talked about this in a previous webinar. Energy levels can go all over the map when the sugar levels are not managed properly. When sugar spikes, you might feel really great, but then because insulin is going to drop those sugar levels back down again, you're going to have an energy crash, and then you're going to eat some sugar, and then your energy will go back up again, and then you'll crash. And so that yo-yo of energy throughout the day is related to sugar. Just a quick introduction on those pieces. Now, again, my name is Dr. Bhavesh Patel. I've been doing wellness-based medicine for 11 years with my practice here in Chicago at Cenegenics Medical Institute. We help people stay young and fit and healthy. And one of the ways we do that is through a lot of testing. We do testing for most patients 4 times a year, and we do advanced testing, not just scratch the surface testing. The way I like to think about that is, if you were to see an iceberg in the ocean, what you can see visually is just the tip of the iceberg, and that's sort of like just the most basic superficial testing. You're going to see just that little bit, but if you have the technology to use radar, sonar, and look underneath the water, you can see how big that iceberg really is. And once you know what the shape of the iceberg is, you're able to make the right choices with steering the ship to avoid that iceberg and therefore avoid those catastrophes. So when we think about testing, it's what tests are you using, how much are you testing, and what are you seeing with those tests. And that's what we're going to cover today in this webinar is the different kinds of tests you could be thinking about for your blood sugar. So uh, again, that's where I'm sort of thinking about the basic testing versus the advanced testing is the iceberg versus looking underneath the iceberg or underneath the water with additional tests. The second piece is how you interpret those tests. And what I'd like to consider or have you think about is there is passing and failing. So there's when there's completely abnormal lab values, or a lot of it's just normal. But then there's an optimal range, and that's where we like to be when we think about our patients. Is what's the best level that a patient could be from a level standpoint? Maybe a way to think about it is, you can go from fourth grade to fifth grade with a C, but it's not like getting there with an A, right? Both are passing grades. They're both not in the failure category, but the A is a lot nicer than the C when it comes to your health. And so those are the two things to think about. The kind of consider the breadth of the testing, the depth of the testing, and then how you actually interpret those signals. So maybe the iceberg analogy, It'd be not only seeing that there's a huge amount of ice underneath the water, but interpreting it in a way that you can make a better decision with. How you think about that iceberg. Is it dangerous or not? And that's sort of like how you actually analyze the data for your blood work. So let's go over these tests that we think about for testing. So let's see here. Let me get my iPad pulled up. Let's see. Okay, success. All right, so the first test is the fasting blood sugar. This is going to be on every basic panel you ever get. It's called the fasting glucose or fasting blood sugar. And that sugar level is basically what you woke up with in the morning. So the tests, the way that they're done for these is you want a fasting number. That means you haven't eaten anything except for water for 8, 10, 12 hours. The longer the fast, the lower the blood sugar is going to be. We do want to see that number look nice and low overall. So the blood sugar level, that changes minute to minute. If you eat something, it's going to go up. If within 2 hours, it should come back down to a normal number. But the sugar or the fasting blood glucose, which again is a laboratory test that you go get done, should be, oops, sorry, that's not what I want to do. Less than 100 is what's considered normal. Okay. 100 to 126 is called impaired fasting glucose. This is where the body is not doing as good of a job bringing the sugar back down to a healthy normal range. Greater than 126 is consistent with diabetes. So both of these numbers are sort of in the abnormal category. But we talked about optimum category as well. And in my medical practice, we like to have that number less than 86. And that's just because we know that at numbers less than 86, you're going to have less risk for dementia, less risk for heart disease. The higher the number gets, the more risk there is. Now, some people are still never going to get quite under 86, but that's why we look at other numbers. But again, this is what we might consider an optimum range here. One other point I want to make about these numbers in terms of ways to think about it is all of these numbers are giving you some insight into what's going on with the body, but not every number is going to give you the whole picture. It's sort of like if you were thinking about the economy. If you looked at the Dow Jones one day and looked at the S&P 500, and then you looked at inflation and consumer confidence and housing starts, et cetera, you can look at all these economic indicators, and it's going to give you an idea of what's going on with the economy, but you might still not get the whole picture. And numbers are similar. So with the fasting blood sugar, what we're looking at is a short window of time. It's giving us an idea of what that blood sugar is at the moment. For a longer term test, and this is what historically has been used for making sure, seeing what people's diabetics, what their long term sugar control is a test called the hemoglobin A1C. And this is a 3 to 4 month average of how high the sugars have been. Now, it's important to understand how this test is done. What the test does is it measures the amount of sugar that's stuck to red blood cells. Because red blood cells live for approximately 90 days, they take they take that measurement of the sugar stuck to red cells, put it through a formula based on the lifespan of 90 days, and get an average idea of what the blood sugar levels have been for those 3 months. So the reference ranges for this are 5.7 to 6.4 is an increased risk of diabetes. Okay. And then greater than 6.5 is consistent with diabetes. Now, all diabetics will get this number checked routinely. There are many physicians who are starting to check this number just as a diabetic screen. It's not indicated for that, but we're seeing more and more people do that. But from a longevity standpoint, we like to see this in the less than 5.1 range. When the glycation is that low, when there's so low sugar that the cells are not getting gummed up, we know that helps improve longevity. So from a standpoint of what's optimum, we like to see that less than 5.1 category. Now, what are the limitations of this test? Well, the part of it is that not everybody's cells live exactly 90 days. They can live up to 120 days. So if the cells are living longer, it's going to have more time to glycate. The A1C might look a little higher. On the flip side is for some people who are diabetic, the cells actually live as little as 66 days or so, and you might have an abnormally low A1C. It may not reflect the true picture. So again, that's where the number is great to have, but knowing what it's telling you, what it's not telling you, and interpretation considerations come into play. Now, the next test that we always include is the insulin. So as we had talked about in a previous webinar, and just as a reminder to anyone who missed that webinar, when your blood sugar goes up, your body has to release some insulin to start bringing that blood sugar back down again. Okay, and as the insulin, so the orange is the insulin. Okay, this is your insulin, and this is going to be your sugar. The sugar is going to start to come down again, and as it does, your insulin also comes down, but it comes down a little bit more slowly. It doesn't come down as fast. What's going to happen is as you get hungry and the sugar levels drop, you're going to eat again. And then that's going to raise your insulin up again to match. And you'll kind of have this a bit of a yo-yo effect. And so this is why managing your blood sugar levels and your insulin levels have such an impact on your weight and your glycation. The idea when we're trying to get someone into a healthy zone is to have a graph that looks a little bit more even. So those blood sugars are kind of maybe hovering in this lower level state. And that's a whole different kind of webinar. But the reason we check the fasting insulin is to see where someone's at. So numbers for insulin, again, this should be a fasting number, meaning you wake up in the morning, you haven't eaten for 8, 10, 12 hours. Insulin levels for us, we like to see less than 5 is what we consider optimal. I think somewhere in the 12 to 15 range, I would consider this insulin resistance. And greater than 25 is the diabetic range, maybe 24. But so remember, this 20 range is diabetes. So again, we want to see this number closer to the low levels from an insulin standpoint. So for me, again, bare minimum fasting blood sugar, hemoglobin A1C, and insulin should be checked. Now, I have a couple other things that could be considered. There are times when maybe we want to find a bit more out about how your body's handling blood sugars. One test is called a glucose tolerance test. So the glucose tolerance test is going to give us an idea of how efficiently your body is getting the sugar back down to a normal level. So what I had mentioned a little earlier, I said it kind of quickly, is that the sugar levels should go back to normal within about 2 hours. So let's say this is time 0, this is 1 hour, and this is 2 hours. And let's say you have a number that's less than 100, because that's where a normal blood sugar would be. And you start here, they're going to give you, or you're going to take what's called a 50-gram dextrose load. It's like a sugar water. And as you eat that, your blood sugar is going to go up to some number. What we want to see is that within 2 hours, we're back down to normal. Okay. The blood sugars got back down within 2 hours. That would be a normal glucose tolerance test if everything's working correctly. Now, what can happen is your body's not that efficient at getting the sugars back down. This can be if you're overweight, if you have impaired insulin issues or fasting glucose issues. The sugar's going to go up, but it's going to take longer to come down. Maybe it takes 3 or 4 hours to come down. Let's say this is 3 hours. This time here, where the sugars are elevated, all that extra sugar is causing that glycation or the sticking of sugar to cells and damaging the way they work. It's also a pre-diabetic condition. So there are times where maybe, in a whole fast after 8, 10, 12 hours, all the numbers look great, but you could still be struggling with impaired fasting glucose or glucose control issues. It's taking 3, 4, 5 hours for the sugars to get back down to normal. You don't catch it with that fasting test, but you can catch it with this test. And what's really popular or starting to get more popular is what's called CGM, continuous glucose monitors. Now, these devices implant a sensor into the skin, and you have a device, whether it's an iPhone or some other device, where it reads the sensor and is checking your blood sugar every 5 minutes or every 15 minutes. Biohackers are using this to see how their body responds to sugar. They use it, it's primarily been developed for diabetics who are insulin dependent so that you can see what the blood sugars are, how much insulin needs to be secreted into the bloodstream. This saves you from having to prick your finger throughout the day. So the glucose monitors are, there's actually a company called veri.co where you could do this. Nathan, who works with me, had been telling me about a company called Levels. There's a company called Dexcom that's been out there. There's a Freestyle Libre. But the idea behind the continuous glucose monitor is it's just checking your blood sugar level through the day. And now if you have a blood sugar, you can, if you were to eat something, you can see how your blood sugar reacts, how long it takes for that blood sugar to get back down to normal. You might find certain foods impact you greater than others. If you want to see what pizza's going to do or burger's going to do, if bread is, how much of a difference bread makes in your sugar management versus not having the sugar on board. And that way you can start to figure out what's right for you in terms of foods that you should be eating or not eating. So those are the other additional tests to do. So again, that's the continuous glucose monitor or the glucose tolerance test. I guess if you wanted to do a cheap version of a continuous glucose monitor, you could prick your finger every day or several times a day. It's a little painful, but you could check your blood sugars with the same kind of blood sugar monitor that diabetics use when they prick their finger and see what the blood sugar levels are like. So that's another option. Let's see, I think that covers it for the types of testing. That's going to give you a really nice idea of how your body's metabolism handles blood sugars. You want to know where you're starting. Are you someone with impaired fasting glucose or pre-diabetes, or are you already optimal? This is the kind of testing that you could start to get a handle on where your body's at, so you know how aggressive you need to be with your nutrition or your dietary plan. You'll know what the impact of exercise might be on your blood sugar management. But if you don't know where you're starting, you really certainly don't know where to go and what's right for you. That's where testing is really helpful. There are people who, maybe are fortunate enough to eat whatever they want and don't ever have blood sugar issues. And there's other people who have to be very strict. That's you. That's going to be based on your genetics and your life and your body. But if you don't know, you won't know what to do. So now that we mentioned that it is important for you to get your labs done, what are the ways that you can order your labs? Well, the first thing is I would see about getting an appointment with your doctor. So book an appointment. So perhaps if you have your insurance card in your wallet, you can go to the website or call the phone number. Maybe block some time in your calendar to do this, but to get the labs ordered, that's one way to do it. You can order your own labs. What's really great about medicine today is that there are many opportunities for patients to empower themselves. And one of the ways is just to order your own labs. So let's try that now. So if I just type in order labs, here's order labs online. And we can see that there's a number of companies that offer this. Quest Diagnostics, they're a large company that's nationwide. And here you've got the different kinds of tests that are available. Um, let's see what they have here. So let's just look at general health real quick and see what the options are. If it tells what tests there are. Here we go. So these are the tests to see if there's anything for diabetes or blood sugar. So here's the diabetes management test. Let's see what they test here. So this test looks like this is just the blood glucose. That's not really much. So I don't think this is really a great option for, they have the hemoglobin A1C. So this is the glucose and the hemoglobin A1C. We're missing the insulin on this one. So let's try another company and see what's, just to see what else is out there. So here's Alta Lab Tests. And it looks like they're nationwide. You can find a test, order a lab test. There's service centers around the country. Let's see. Test by body systems. So this is for this company. Maybe I would do. Let's see. There's body systems heart. Let's do metabolic and endocrine. That's where diabetes should be falling into. So here's diabetes. They've got the hemoglobin A1C and a few others. Maybe you have to just type them in individually. So if I want the insulin test here. So here's the test here for insulin. Didn't seem like it came up as part of a panel. But you would add this in. So I guess you would just press the add to cart button and then order the test that way. Let's try one more company just to see what else is out there. But again, the point being here is that you can order your own labs without having to depend on a physician, especially if your physician is unwilling to order some of the advanced tests. And usually that's due to, costs. So here they've got the hemoglobin A1C under the popular test. So again, another lab. This is called walk-in lab. There's LabCorp. LabCorp is another major lab. So that's one way. The next thing is maybe you already have labs done, right? I would just check your own labs. That might mean logging into your MyChart, or if there's whatever online platform your provider is using, log in, see what labs are there, see what's missing. So check your labs, see what's missing. Maybe they did a hemoglobin A1C, but they did do an insulin, or maybe they only did the fasting blood sugar and said everything was okay. Maybe your fasting blood sugar was 99 and it was quote unquote normal, but really a 101 would have said abnormal. So check your labs, see where you fall within the reference ranges I had given. Hopefully this gets you started, but I would do one of these three things and start taking charge of your own health. All right, guys, I think that's we're getting close to the end of time. Angela, do we have time for some questions though? If we maybe 2 or 3 questions. Do we have anybody in the chat who's dropped any questions?
Dr. Patel, we do. So the first question someone asked is, when I do a standard lab for glucose, A1C, and insulin, is it bad to fast for longer than 12 hours? Does the amount of fasting change the frequency of the results?
That's a really good question. I think, probably it doesn't matter if you fast longer. Having said that, I do think what can happen is sometimes if your blood sugar levels drop too low, the body will read that as, hey, we have low blood sugar. We're going to secrete some sugar out of our own organs back into the bloodstream to keep the sugar level up. So there are a lot of times, especially people who are pretty healthy, they'll have low hemoglobin A1Cs, low insulin, but the sugar levels are a little high, and that's probably due to something called gluconeogenesis. Neogenesis means make new, gluco means sugar. So your body's just making some sugar. So you might see a slightly elevated fasting blood sugar for people who have fasted for a long time, even though the other two numbers are good. And I think if somebody wanted more clarity and depth into their blood sugar metabolism, maybe a glucose tolerance test or the continuous glucose monitor could be useful.
Dr. Patel, we have another question actually regarding the continuous glucose monitor. You had mentioned that in addition to diabetics, biohackers use that device. Is it something that has to be prescribed by a doctor?
So this is another area where I think it's changing. So so the Dexcom, requires a prescription. It's a medical device. I think the Freestyle Libre is over the counter, but I had found recently, I think through an ad, but this company called VIRI.co. This one, you do not need to have a physician do it. I think this maybe includes like a physician visit, perhaps, on how they do it. But this is a company where you would just um, get the glucose monitor from them. So this has a sensor for 14 days or two sensors for a month. It's about a couple $100 here. But yeah, you would just do this on your own. They've got an app and you can monitor your meals. So this is what, if I was a biohacker, I might be thinking about. This company, I think Levels is another one, if I remember correctly. Levels CGM. Oh, see, this is the Freestyle. So with the Freestyle, you have to have a prescription from your healthcare provider. So you fill up the form, get a prescription, and then you can get the CGM at a pharmacy. So this is going to require a physician on that one. We'll see here. There's another company here called Signos. See what happens if I request access. I don't know what that is, but yeah, it looks like there's options either way. So either a physician writes a prescription for the ones that are been around for a while, like Freestyle or Dexcom, but there looks like there's other ways to do it without having the physician write you. Here's the Levels one. Also, I think this is really up and coming as far as patient-driven CGMs. We're seeing a bit more of that. I think the request access means that you're just going to get in a queue to get it done. So, but yeah, Google up continuous glucose monitors or CGM and see what your options are. And again, if your physician's willing to write the prescription, then it should be very easy. I think we have time for one last question.
Dr. Patel, we don't have a question, but a thank you from someone who said that this course has really helped them understand their own body and have the confidence to kind of approach their doctor with questions that they had.
Oh, yeah, that's awesome. Thank you very much. That's very nice. That's the purpose of this. And the reason why I wanted to do these webinar series is to empower patients with the knowledge and the education so that they can be in charge of their own health. With the knowledge, you get to make the choices that are right for you. So with that, if there are any follow-up questions after today, feel free to come to the website, at www.BhaveshMD.com, where I'll have the webinar posted. There'll be a place for you to ask some questions. If you'd like to make an appointment to just speak with me for a short call, you could do that through the website. Otherwise, everyone have a great day. Thanks for tuning in. Hopefully you enjoyed it. We'll see you on the next one.